Welcome. I am Terry Tropin, and today I'll be discussing the 2023 updates for CPT's evaluation and management codes. But first, let me tell you a little bit about myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have RHIA and CCSP certifications. I also am an AHIMA approved ICD-10 trainer. I taught health information technology at Montgomery College for over 20 years. I also have written books on coding. These books are study guides that I developed for my classes that summarize the coding guidelines, put them into simpler English, and then do a comparison of them. My books include one on E&M coding, ICD-10 CM coding, ICD-10 PCS coding. The 2023 versions for the CM and the PCS coding are already up on Amazon since those are effective October 1, 2022. The evaluation and management coding update book should be available in the fall. These books are all updated every year. So this is what we're going to talk about today. This video covers changes to general guidelines, key components for examination history, and use of time to select codes. Now there's so many changes that I can't do them all in one video. So in part 2, I will discuss changes to medical decision-making codes. And in part 3, I'll discuss changes to specific categories of codes. These videos, part 2 and part 3, should be up shortly. Okay, so let's look at the changes to the general guidelines. So this is more a clarification than an actual change, but here's the wording that was added. The new words throughout this are indicated by underlines. So the wording is, within each category or subcategory of E&M services based on MDM or time, there are 3 to 5 levels of E&M services available for reporting services. Levels of E&M services are not interchangeable among the different categories or subcategories of service. For example, the first level of E&M services for office visits, new patient, does not have the same definition as the first level office visit, established patient. So new patient, established patient, even at the initial level, are not the same. Each level of E&M services may be used by all physicians or other qualified healthcare professionals. As I said, this is more a clarification than anything else. So also changes to the general guidelines. The place of service and service type are defined by the location where the face-to-face encounter with the patient and our family caregiver occurs. For example, service provided to a nursing facility resident brought to the office is reported with an office or other outpatient visit. So it's where the patient is, not where they live, like in a nursing facility. So this nursing facility patient seen in an office is coded as an office visit. Now this guideline expands a bit on the definition of shared or split visit. So you can see here that there's been some editing. So this here jointly was crossed out. The word both was added. And then this part here was added. So a shared or split visit is defined as a visit in which a patient or other qualified healthcare professional jointly, no longer jointly, but both. So jointly seems to imply together at the same time. So I think that's why they made this change. And in the second paragraph, it talks about what kind of services are provided. And in this case, it clarifies that and says, and or counseling, education, communicating results to the patient, family, caregiver. So mostly a clarification. Now, this goes into the most important part of the changes we're going to discuss today. Sections of the guidelines were deleted. Guidelines common to all E&M services and guidelines for specific areas, hospital observation, inpatient consultations, ER, nursing, rest homes, etc. So the reason this is that in 2022, there are different guidelines for outpatient office and then different guidelines for hospital observation, etc. So these are now all together in an area titled Classification of Evaluation and Management Services. So these were all together. Okay, so first let's look at E&M coding, the key components. Here's a statement about history and our examination. E&M coding that has levels of services, including medically appropriate history and our physical exam when performed. The nature and extent of the history and a physical exam are determined by the treating physician or other qualified healthcare professional reporting the service. The care team may collect information, and the patient or caregiver may supply information directly that is reviewed by the reporting physician. The extent of the history and physical exam is not an element. So they got rid of this here. So in the 2022 edition, this was in the guidelines for office or other outpatient E&M services. Now it's all E&M services. So the history, the social history, past history, family history, whatever, we don't need to count different elements within that. The physical exam, we don't need to count how many body parts were touched or what was examined. That's gone. What they're doing is trusting that the provider will perform whatever history and exam is needed in a specific case. So other changes to the 3 key components. So remember the changes in 2022 where history, exam, and medical decision making were deleted, but only for office or other outpatient services. For 2023, this is expanded to all codes. So here's an example. 99304, initial nursing facility care per day for the evaluation and management of a patient, which requires, and the key components phrase and all the listing, that's deleted. Added was a medically appropriate history in our exam and straightforward or low-level medical decision-making. So big change. Also deleted under all the codes is the phrase counseling and our coordination of care with other physicians, other qualified healthcare professionals, or agencies are provided consistent with the nature of the problems and of the patients and our families' needs. Deleted. And then for time, we're going to get more into this later. Usually the presenting problems are of low severity. That was deleted. Typical time. Typically, X number of minutes are spent at the bedside. That was deleted. Now it says, when using total time on the date of the encounter for code selection, 25 minutes for this particular code. And all that other stuff about typical time and bedside, all that is gone. So once we get used to this, this will be actually easier. So this was deleted for 2023. Time may be used to select a code level in office or other outpatient services, whether or not counseling or coordination of care dominates the service. For other E&M service, it used to be that you had to do counseling, coordination of care, but now it says, no, there's no requirement for either office outpatient or other E&M services that have a time. So the time is just like total time. It doesn't have to be time spent counseling, the 51% spent counseling that it used to be. None of that applies anymore. Okay, other changes to the key components. So what we have are most codes are selected using either time or medical decision making. One or the other in most cases. So for example, 99221, initial hospital, inpatient, or observation care. That's a difference too, but I'll change that. I'll discuss that in part 3 of the update. Per day for the evaluation and management of patient, which requires no more key components, medically appropriate history and examination, and straightforward or low-level medical decision-making. Total time, 40 minutes. So it's either straightforward or low-level medical decision-making or the 40 minutes. You can use one or the other, whichever gives you the higher level, according to what's documented for specific patient. Now, some codes are based on either time of medical decision making, some are based on medical decision making only, and some are based on time only. So let's look at emergency department visits. 99282, 3 key components is deleted: medically appropriate history and exam, and straightforward medical decision making. Now, ER visits didn't have a time component in the past because it wasn't thought to be appropriate for this particular case. But at this point, all you have to select a code to differentiate the code is that medical decision-making component. Now, other codes are based on time alone. So here's an example. To report 99238, hospital inpatient or observation discharge day management, 30 minutes or less on the date of the encounter. Now this is, they've added inpatient observation to this code, and they've added on the date of the encounter to this code, but it's still only time. So you have some with medical decision making and time, some with time, and some without medical decision making only. So it varies. Okay, now notice also that for 2022, some of the codes refer to typical time. In this case, it says total time. It's nothing typical. It's just this is how much time. And it's on the date of the encounter. Note that the typical time used in 2022 did not automatically translate to the same amount of time on the date of the encounter. So if you have super bills that have time listed on them, you need to double check those and see if the time has changed. Now, sometimes the time has stayed the same. The time component for 99304, for example, initial nursing facility, remains at 25 minutes. 25 minutes in 2022, 25 minutes in 2023. Sometimes the time component was actually decreased. For example, the time component for 99252 inpatient consultation was revised from 40 minutes down to 35 minutes. On the other hand, sometimes the time component was increased. For example, 99347 home services revised from 15 minutes to 20 minutes. So check those times on your forms. Okay, also, the 2022 guidelines include a specific guideline for face-to-face time. This has been deleted. Face-to-face time, coding purposes, services defined as only that time spent face-to-face with the patient, sitting with the patient or with the patient's family. Obtain a history, exam, counseling. Now, also was deleted was the paragraph about unit floor time, which was defined as time present on the patient's hospital unit, at the bedside, giving services, to review patient's chart, etc. This was deleted. Now, this has kind of been these two paragraphs that were deleted have kind of been taken into this paragraph. For coding purposes, times for these services is the total time and the date of the encounter. It includes both face-to-face time and non-face-to-face time. Okay, does not include time of activities normally performed by clinical staff. So wording was added. It includes time regardless of the location of the physician or other qualified healthcare professional, e.g. whether on or off the patient unit or in or out of the outpatient office. So this kind of incorporates what we had deleted in the last two slides into a new paragraph. It does not include any time spent in performance of other separately reported services. So changes to time. When prolonged time occurs, the appropriate prolonged services code may be reported. The total time on the date of the encounter spent caring for the patient should be documented in the medical record when it is used for the basis of code selection. Now this changed from appropriate to total, and other than that, it's not a big change. Now this is important. Total time on the date of the encounter is by calendar date. When using medical decision making or total time for code selection, a continuous service that spans the transition of 2 calendar dates is a single service and is reported on 1 calendar date. If the service is continuous before and through midnight, all the time may be applied to the reported date of service. So if the patient is seen by the physician from 10 p.m. on Monday to 6 a.m. on Tuesday, this continuously, this is counted as time spent together. It's all added together before midnight, after midnight. So it's all added together instead of a one date, one for Monday and one for Tuesday, separate codes. Okay, this completes the video. If you have questions or comments, please feel free to contact me. For more information on the total changes that have been made, that will be made for 2023, the link to the information on AMA, from AMA, is in the introduction to this video. I will post parts 2 and 3 of E&M changes videos as soon as I can. If you would like to purchase a copy of the slides for this video, give me a thanks of $5 or more and comment with your email, or send me your email by to my Gmail address. I will then send you a PDF of the slides. If you enjoyed this video, please give it a like and subscribe by clicking on the picture in the lower right-hand corner. So here are the books I've written on coding. The 2023 PCS and 2023 CM are out and available on Amazon. The E&M coding book will be available sometime this fall. Thank you so much for listening. I hope this was helpful. Thank you. Mm-hmm.